When we talk about cardiovascular health, I think a lot of that information and a lot of our focus ends up on cholesterol as a driver of heart disease. And that's a really important topic. But a lot of places you go when you seek medical care, they're going to look at total cholesterol, HDL cholesterol, LDL cholesterol, and triglycerides. Based upon those four very basic tests, they're going to make a determination of whether or not you should be on a statin. That is not enough information to move forward. What we want to do when we look at cholesterol, we actually do an MRI on your blood because we want to know not only how high is your LDL, but are they small dense particles or are they large buoyant particles? That factor alone can help determine whether or not you develop heart disease. We use this data in conjunction with family history, other testing like LP(a), ApoA levels, ApoB levels, to make a decision about whether or not a statin might be right for you, or whether or not a drug like Zetia, which blocks the recirculation of bile, might be a better idea for you with less side effects. We fully explore your cardiovascular history as well as your potential for developing cardiovascular disease. Also, where does your cholesterol come from? Do you absorb it from your diet or do you manufacture it? There is so much that goes into cholesterol testing that goes so far beyond this idea of total cholesterol, LDL, HDL, or triglycerides. That algorithm to decide whether or not you need a statin was designed in 1974. And many practitioners are still using that data as the only points to determine whether or not you need medical therapy for your cholesterol. You don't ever start with medical therapy. You want to start with lifestyle therapy. Cholesterol often is a symptom of lifestyles that don't really go along with the genetics that you have. So before you consider taking a statin, before you consider taking any medicine for your cholesterol, a lot more data needs to be gathered.